People who are just getting, introduced to this world, what are the different types of therapy?
Sure. So this can be a really overwhelming and daunting process for people, and I really want to try to simplify that. Today, a lot of people are entering more short-term evidence-based type therapy that can be cognitive behavioral therapy, which is the idea that our thoughts create certain types of emotions. It can be dialectical behavioral therapy, where we focus on mindfulness and relationships and being able to regulate our emotions. Exposure therapy is wonderful. So if somebody has a fear of dogs or taking the elevator, you can do some exposures with a therapist.
Oh, and I see family and couples therapy, which we sort of understand.
Yes.
We talked about that. I love this conversation. When you're trying to choose a therapist, though, it's so important to make that connection. What are some of the questions? How do you screen someone to see if it's going to be a good fit?
Sure. So first and foremost, you want to make sure that they specialize in whatever you're seeking treatment for. So whether that's anxiety or depression or grief or loss, it's important to make sure that they are an expert in that area. And then also, that connection that you have with somebody. I like to say that we have a feeling about somebody within the first couple of minutes we meet them. And it can be very overwhelming in that process, but really that you feel like you're being seen and heard and understood. And if it's not a good fit, you do have to shop around for a therapist.
And that's okay to do.
It's interesting because only really in recent years have we seen health insurance companies really recognize the validity and the need of mental health services and really begin to cover them. But what about people who are uninsured? What can they do?
Sure, there are so many resources out there, especially for college students. They can receive free therapy on campus, and I think a lot of students don't know that. There are community mental health agencies. Back 20 years ago when I first started, I worked and provided free therapy to people in the community. There are waiting lists, but certainly there are online options. There are free 12-step programs.
Even if you're not in college.
Even if you're not in college. Thank you for specifying that. For older adults as well, there are many resources, and as a social worker, oftentimes my role is to connect people with different types of resources. We just have to ask.
And even sometimes in the cultural enclaves, like Chinatown, they'll have services that are specific to certain cultures as well. What are the benefits when it comes to virtual therapy versus doing it in person? Is it better to do it in person, or are we moving to a hybrid model?
So I think that since the pandemic, it has been an opportunity for people to receive therapy no matter where they're based. Some people who are in smaller communities can find a therapist who is an expert in their area virtually, so they don't have to travel and they have more resources. However, there is something about sitting with somebody and being in a sacred space. I converted completely from in-office to virtual, but that has given me an opportunity to work with such a large community of people throughout the state of Illinois.
There's still, I think, sometimes some barriers to therapy, right? And some people just have a mental block around it. What can you say if you know someone who could really benefit from just having a safe place to talk? How could you maybe, in just a few seconds, convince them to be open?
So we need to look at mental health similarly as physical health. It's like a personal trainer. You don't have to have some detrimental issue that you're struggling with or a label. We all need support, and it's so helpful to talk through things.
Absolutely. Psychotherapist Kelly Kitley, thank you so much for walking us through the different types of therapy and the resources that are available to all of us.
Absolutely. Thanks for having me.
Stay with us. You're watching.